Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we're going to be taking a look back at the health IT ups and downs of 2021. And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 16 years of health IT blog content at healthcareittoday.com. 2021 wasn't quite as bad as 2020.
I think actually it might have been just as bad, but we were used to it.
Oh, is that what it is? We're just used to the pain and suffering that we're now.
The isolation, the being away and being able to see friends and stuff. I think we just sort of learned to adapt.
Yeah, that might be fair. If we look at it 30 years from now and we're telling stories to our kids, though, 2020 is going to stick and 2021 is not going to get any stories.
Yeah, pretty much. I view it like, well, you don't have them where you are, John, but, going through like an ice storm or something like that, where the power was out for like a day and a half or 2 days. During the time, you're like, oh my gosh, this is like the worst thing ever.
Yeah, I got stuck at my house for a day and a half.
I know, exactly. Well, without power, right? But then like, a year later, you kind of like, you forget all the pain and you remember, oh, we had a lot of fun with like the candles and we went to bed early and, just, I hope that's what will happen when we look back at 2020 and 2021 years from now.
Well, I mean, for sure. Even now I look at 2020 and I think of the movie nights with my kids, right? So I think there's something beautiful about that. I mean, you see it with a pregnancy, a week after when she's like, that wasn't too painful. And you're like, do you remember? Like, yeah, it was pretty bad. And you were amazing, but it's great that you don't remember that.
Yeah. And I can't believe we're already at the end of the year. And, that's why we're doing this looking back episode. So let me ask you this, John. What were some of the biggest stories of 2021?
Yeah, so I kind of have three themes of stories really, and they're kind of trends throughout the whole year. The first one is just the cash. I mean, the cash that's flowing into healthcare right now, the investments, the hundreds and millions, like we've always had the 5 million here and there, occasionally a little 20 million spot, Series B or something, but just the hundreds and millions, which of course aggregates to billions of dollars that's flowing into digital health, telehealth, healthcare AI, et cetera. I mean, it's incredible. Like we usually post one funding or one acquisition announcement a day on Healthcare IT Today. And we need to do more than one because there's just so much happening. And so consolidation's happening as well, but just the cash that's flowing around everywhere is that's one. And then the second one I have is burnout. And we talk about physician burnout, but it's staff burnout. Nurses are leaving. Everyone in healthcare is burnout. And I guess everyone in the world is burnout to some extent too. So I think burnout's maybe the second biggest theme of 2021. And then the third one I'd add is just kind of the lingering COVID, I guess is what I'd call it, right? Like the kind of COVID overtones of everything we do. So I think those are my top three. And if I were to put them in order, I'd probably put cash first, right? I mean, that's going to transform healthcare as we know it.
Yeah, I mean, I think transform both in the good and the bad sense of that, right? I totally agree with you. That's a great choice of top story. I think as we know in healthcare, the sales cycles, the time it takes to gain traction can be very long, and so I wonder if all this cash has the staying power, right, and the patience to see this through. So that'll be interesting to see what will happen 2 or 3 years from now when maybe the results aren't quite there and, people start pulling the plugs.
Well, and if you raise 100 million, you've got to exit at the multi-billion, which those numbers don't quite work out. A venture capitalist that I read his blog is Fred Wilson at avc.com, I think is his website, but he's been blogging for 15 years. I've read him and he just did the math of people raising at these $100 million billion valuations, he said this math doesn't work out from an investor standpoint. It's too high, and there just aren't enough multi-billion, 10 billion, 100 billion exits. There's those companies are few and far between, and in healthcare that's even more so the case. So I think that's going to definitely come to rue. But the nice thing is that the digital exhaust from those companies where they spent hundreds of millions of dollars and built really quality products are still going to remain and still going to provide awesome uh, experiences, et cetera, for patients.
Yeah, those are good. That's great points. I'm going to take a slightly different approach to answering this question than you, John. I'm going to go with three very specific stories for me
Okay.
that stood out in 2021. Number one for me is, of course, the new CEO at Cerner, Feinberg. To me,
Yeah.
that was a huge story.
Big news.
Yeah, it was big news for the industry. It was big news, obviously, for both where he came from and where he was going. So what happened to Google afterwards in terms of folding health into all
Yeah,
other
that's true.
departments of Google, and then of course, yeah, what it meant for Cerner, who I don't think I think some people would have said they were struggling. To me, it was more they were just sort of plateaued a little bit. Um, and now with some new leadership and maybe some new energy, it'll be exciting to see where they're going. So definitely for me, that was a big corporate move. I mean, you don't see those moves quite so often like that in healthcare, especially at those size companies. So I thought
Yeah.
that for
And
me
there's
is
a
a big
lot of
news story.
questions, right? Like why him and everything. And I still have some of those questions, right? But I think what he has shown already is that he is a leader.
Yeah.
And that's clear in everything that he's done, that he's going to create a strong vision and he's going to lead with a strong vision. And I think that could be powerful for certain.
Yeah, what I like about it is he didn't come in with a big axe, nor did he come in with big bold statements, right? Like he has taken his time, and to me that's a sign of okay, trying to figure out what's going on there, get the lay of the land, and to me that's a better sign of someone really trying to fix it or improve it, rather than someone coming in with some predisposed notion of okay, we got to go here, and then immediately starting to cut and rejig and everything. So anyway, that to me was number one. Number two was actually the acquisition of Nuance by
Microsoft.
Microsoft. That was a very big one, both in terms of just in tech, right? One of the biggest NLP, well-known, well-established NLP players out there, has done tons of stuff for voice recognition. Now owned by Microsoft, who has continually to make big bets in healthcare. So to me, that was another top story. And the third one for me was actually the announcement of Vive. That was
Oh,
a big one for me
there you
about
go.
both in terms of what it meant, given that combination of those two organizations to do an event like that, and also, of course, as everyone knows, the timing of that event right before the other big event in the season is kind of interesting. So to me, those three stories were tops in 2021.
Yeah. I mean, Microsoft went all in on ambient clinical voice, and I'm excited to see that play out since we all want that to be successful, and they got the billions to invest in it and really refine it. So that's great. Yeah, Vive is going to be interesting. Everyone's asking me about it. Everyone's saying, "What is this Vive, and how's it going to play out, and what about hymns, and what?" So that's going to be definitely be an important story to follow. It's interesting. The evolution of all of this, right? And the desire to get back in person, at
Right.
least to the large events, and it'll be fun to see how that evolves in the next year. Because in 2021, we were all really anxious to see each other, right? So, that was maybe another theme, I guess, looking back at 2021 was, that feeling. But what are some of the missing stories of 2021 that you think maybe we haven't heard about?
Well, there was one. I'm going to go reverse and go over the themes, but there was definitely one theme that I didn't hear very much about in 2021, and that was inflow blocking. Like,
Mm,
it was supposed to be the big story of 2020. It wasn't. I thought we would hear some more stuff about it this year. Now that the rule has been in place for a little while longer, and people, have come to more grips with it, but to me, it didn't even bubble up anywhere. But there was
hmm.
some talk about it and here or there, but it certainly wasn't the story that I thought it was going to be in 2021. So for me, that was one that was missing. And then right alongside of it, interoperability. We didn't hear as much, and I think some people would be relieved about that. But to me, that just meant we maybe weren't putting as much focus on it as we could have.
Yeah, that's interesting you said that because I'm going to disagree with you later. But yeah, the story I think for me that was missing in 2021 was the impact on patients.
Mm.
We've talked a lot about the impact on nurses and the impact on doctors and the burnout there, right? Which I highlighted as a important theme of 2021. And there was some for sure, the impact that patients had, but I don't think nearly enough. And maybe it's a realization that healthcare is a bit misguided in in many of its efforts, because the loss of those nurses and doctors is going to just smash patients, right? The loss of telehealth and access to telehealth, that's not going to hurt a doctor. That's not going to hurt a healthcare organization, but it hurts patients a lot. And so, there's been some stories of that, but, I think there definitely is missing just how deeply it's going to these changes are going to impact patients in a dramatic way. We had a few with COVID, right? They didn't come in for their checks, et cetera, right? But I think it's going to be much more dramatic than what we expect. And I understand why it's a hard story to cover, because it's going to affect individuals. It's not affecting 30,000, whatever, right? So it's hard to write that story when it's affecting millions, but it's a million stories. And so I think that's where it's hard to cover. And so that's why we probably missed some of those stories.
Yeah, I think you're right, John. I mean, patients are perennially on my missed stories list. I mean, we don't
Yeah.
really talk about patients enough, period, right? But I
Mhm.
think you're right. Definitely in 2021, we didn't really talk about them maybe as much as we could have in terms of the impact that all these new techs and all the new restrictions and all the things that have happened in the past 2 years have had on patients. I certainly think we have heard a lot more about behavioral health and the impact that this pandemic has had in terms of stress levels and those kinds of things on people. But other than that, you're right. It hasn't really been sort of the year of the patient, right, or anything like that. Certainly in
Yeah.
2021.
Well, that's fair. We've heard of the impact to our emotional health and the impact to some of our other health, right, because of the pandemic, but not the impact of changes in healthcare on the
Sure.
patients and how that's impacting them, or even getting access to care, getting access to certain drugs because there's supply chain issues, et cetera. I mean, I think patients have been impacted more dramatically in 2021 than maybe any other year previous.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're talking about the ups and downs and the big stories of health IT in 2021. So, John, we've talked about some of the big stories. We've talked about some of the missing stories. Was there a story that you think kind of flew under the radar? Like we covered it or other people covered it, but it just didn't sort of bubble up as much
Yeah.
as you thought?
Well, I love that you said interoperability was a missing story, because it obviously flew under the radar for you. Because that's my missing story, that I would describe it as the maturing of interoperability.
Okay.
And it's not so much necessarily that we saw this explosive growth, although, there are some amazing numbers from Direct Trust that passed 2 billion messages and different things like that, right? I mean, there are some benchmarks that's showing that's growing as well. But to me, it's the maturing of the conversation around interoperability. And it did highlight one thing that's really a problem. I saw a great tweet that said, CCDA was developed for 10 years and finally became a reality 10 years later. HL7's, version 2 was done here, and a decade later, it finally saw its inflection point. Fire was started, in 2010, I think, and then 2020, we're starting to see the fire inflection point. And I thought that was interesting that, like, okay, so a standard takes a decade to finally reach maturity and see an inflection point. There's probably a lesson there that we need to, increase that pace and find a way to hijack that process somehow to be faster. But I think in that regard, the maturity of the conversations around interoperability and their specificity and the standards that are available and the access to data have just been much better and higher quality than I'd seen in previous years.
That's an interesting take on that, John. You know, I hope that's certainly the case in terms of we're finally maturing in our approach to interoperability and certainly the standards. I hope it's not the other reason, which maybe we weren't doing very much in that space, right?
That's
But
possible.
to your point, hopefully it's the same as, hey, like, why talk about investing in your wireless network, right? Like, it's just become part of something you do. It's become ingrained in your operations. I hope that is, what the what the case is.
Yeah,
Um,
for sure.
for me, the story that flew under the radar was supply chain in healthcare.
Hmm.
We heard a lot about this in 2020, of course, with the lack of PPE, and then we heard about it again when the vaccines started to roll out in late last year. But for me, this didn't really become a story, and I thought actually maybe it deserved to because you didn't hear about it, which meant to me all of a sudden we got it working again, right? Like you didn't hear about PPE problems as much. You didn't hear about vaccine shortages and and vaccines being spoiled because they weren't being delivered on time. To me, it was just amazing that we managed to figure all this stuff out with such a big disruption and keep it going to the point where it wasn't a story anymore. Like there was nothing there because we had fixed the supply chain problem. But logistically, thinking about how to deliver medications to patients who couldn't come in, right? And then we didn't, I know there were some drones, but the majority figured out how to do this, right? Like, paper bags at the front desk, right? And labeled with with names of the patients or stickers or like these little things that we did to adapt to the situation, I think, flew right under the radar.
Yeah. Well, I think we've gotten back to normal more than we probably realize, because news reports obviously spout all sorts of different things. But I think you're right, though. I don't know the answer to the question, but is the question I have is, are we back to normal and has it improved and the supply chain's doing fine for these things, or are we just not hearing the stories of it? That's a interesting question. I think, and it probably is a little bit here or there. You hear every once in a while little stories of, patients not being able to get drugs or different things like that. So, and certainly I lived it. My son's car was in the shop for 8 weeks because of chips. So, will that eventually catch up to us as we continue to roll out more technology and the chip crisis, and we have to replace medical devices, et cetera? I think we're gonna, it's probably something we'll hear more about, but yeah, it really didn't pop up into a massive news story for sure.
Yeah. Yeah. I mean, I don't think it's a legend is, let's be honest, it's pretty boring. but but to me, it's just one of those things where you don't think about it and then, the PPE situation happens and then all of a sudden we think about it. So
Yeah. So you're
yeah.
describing it as the disaster happens, the hurricane hits, we all get excited about it and then we forget about it and don't really address it. Interesting.
Yeah, but I also think that I think smartly some people have realized, hey, maybe we shouldn't have everything dependent on one vendor for this type of thing, even though there might be some cost advantages,
Mm,
right? I think that sort of thinking has now become ingrained, and I think that's hopeful for the future of, okay, we need to diversify our supply chain. Maybe we need to look a little bit closer to shore, right, and have at least one supplier or a few suppliers of some critical things here locally,
sure.
right? And
Yeah.
I think that will bode well for the industry as a whole.
Yeah. Will we still be getting hand sanitizer from the breweries, that were doing alcohol? I don't know. So there's another one that I would add in this category of kind of flew under the radar.
Uh-huh.
And that's like how empowered many people have become. And I
Mm,
think it's twofold. One is all of the proactive outreach that many healthcare organizations did to patients has given them this sense like, oh, patients do want us to reach out. And I don't know if it was just they were too distracted, they didn't need to because of the business, all of that, right? But that proactive outreach, that proactive communication with patients has empowered many organizations to be like, oh, we should do this more. And so I love that, right? I mean, I think it's cool that COVID kind of cracked that open for
mm,
people to say, oh, we could be a proactive part of a patient's life. We don't just have to sit here and be reactive to whoever calls in with their chief complaint to do something. So I love that empowered idea for organizations, but then I think also for IT teams. How
Okay.
quickly we rolled stuff out has made us question the previous processes to say,
Right.
wait a minute, if we did that in 2 weeks, how come it usually takes us 6 months? And so I think that it's empowered many leaders to be able to cut through some of the bureaucracy. And I don't think we'll go back to 2 weeks, right? But could we go from 6 months to 3 months and be more empowered that way, while still achieving the same goals of quality care, and not putting patients' lives at risk, et cetera. So I think that empowerment is a beautiful thing that we saw in 2021 for both organizations reaching out to patients and for leaders to be able to be more empowered and push things forward in a way that they weren't able to previously.
Well, and I think you could extend that also to a certain degree to patients, right?
Mm.
When all of a sudden we weren't able to get care from our normal providers, we had to find alternatives, right? We had to figure out ways to rely on ourselves a lot more. And frankly, with the growth of RPM, with remote patient monitoring, we had to become more self-reliant and more involved in our care. So I think certainly COVID and 2021, more so than 2020, was the year where a lot of the stuff is now like, oh, like I can do this. I can take my own blood pressure, right, with this new device, and I can track my own weight, and I can track these things, and I can see the difference I'm making or not making. And I think that's a good thing. Maybe not hitting the radar of everything else that was out there, but certainly I would extend that a little bit to patient empowerment as well.
Yeah. I mean, at least empowered them in telehealth side of things.
Mm-hmm.
How many times did a patient say, well, why can't we do telehealth? And the doctor said, well, that's not the highest quality of care and whatever. Now they'll be like, wait, you did it. And we saw it was fine.
Right.
So don't give me your BS anymore, right? Like shoot it to me straight. And it will still be a challenge, I think. But in that way, they're definitely more empowered.
So John, got to ask this question. What was your favorite story of 2021?
So I'd say the overarching favorite story was people coming together to support each other.
Mm.
Like I loved seeing how much we realized we needed each other, we cared about each other, and that we wanted to help support each other. So whether that was at a conference and at HIMSS or at health or whatever, and seeing the people just sincerely happy to be together, right? And come together. And I think the epitome of all of this was actually the effort from our friends at the Hit Like a Girl podcast and the Hit the Trails journey they took across
Right.
the US and back. That story epitomized exactly what I'm talking about. It was our friends Charisse and Joy getting a trailer, traveling, I think it was 28 states, and Joy will correct me in the notes. But anyway, it was more than I even remembered. It's the last time I talked to her. Multiple states, and they did hike with women in health IT all across the country. And, I was lucky enough to be able to go to like 3 or 4 of the hikes and to be part of that and kind of experience it, and seeing how much people wanted to be together and how these women wanted to support each other was my favorite story of 2021.
Oh, that is awesome. Certainly, that was on my list. The Hit the Trails event that happened, I thought was phenomenal. Just from the grassroots nature of it too. It had that feel of the early days of social media where it's like discovering something new and people coming
Yeah.
out of the woodwork going, "Yeah, I'll come in and support and I'll be there." And of course, the pictures were amazing.
Well, and many
I
people that came were like, I didn't know what this was. I didn't know what I was getting into, but I
right.
was ready to get out. And this was a safe way to get out and go do a hike. And so they were, it was awesome. They even saw you across the border, which
That's
is
right. That
incredible.
that is something I'll never forget. Actually, just being able to, I waved. Joy and Charisse did a stop in Niagara, and just on their own, they wanted to go see Niagara Falls. And I said, "Oh, if you're going to be at Niagara Falls, maybe I can go on the Canadian side and we can wave to each other." I got to be honest, I did not think we would actually be able to see each other just given the distance. But there we were on a bright sunny day, and I brought a big Canadian flag with me, and I was waving it on our side, and we could literally see each other across the river. That was pretty special. That
Yeah.
was
I
pretty
mean, after
special.
all the isolation, it was,
Yeah.
yeah, that feeling of being together and sharing experiences was just phenomenal.
Yeah, that was, and that was certainly the feeling I had at HIMSS. That was the first conference I'd been to since everything locked down, and just first of all, it was a bit weird being in Vegas during that time and having to wear masks everywhere. But and be very cautious because otherwise I wouldn't be able to fly home. But just being able to see people who we hadn't seen in 2 years and being around like-minded folks again was just so special. So that's certainly personally my favorite stories of 2021, being able to reconnect. But I have to say that the story from a news perspective that really got me excited and my favorite stories of 2021 were all around health equity and access.
That's a good one.
So for me, something changed in 2021. We stopped talking so much about social determinants of health because that was kind of a big theme kind of going in. And to me, it morphed to talking about health equity and access to care, and not just meaning like how do we get care, in terms of like digital access. We started to see things like mobile access of clinics and things like on buses and driving them to areas that didn't have transit to get people to healthcare. We had discussions around the equity or inequity of healthcare in terms of if I want to see a doctor who has the same skin color as me, the same cultural background as me, how do I find them? Right. And so there was a sudden realization by the industry to go, oh, this is more than just provider matching, right? This is like now, I'll call it situational matching. I want to see a doctor who maybe has experience with cancer patients, right? And not just someone who's trained in cancer, right? Like, or I want someone not just generic, like with my specific cancer, and all these kinds of things now kind of came to be. And of course, our good friends, Abner over at Consejo Sano, sorry, doing that amazing work. I think for me, that was my favorite stories, is just talking about and hearing about their successes.
Yeah. And, it would have been really inequitable of us to not talk about that because it was such an important story. So I'm glad you brought it up. For me, the shift there was from inequity as a problem to now here's what we're doing to try to address it. So that was the shift I think that really happened in 2021, which was a big change and a good change.
Yeah, I'm hoping that is on our list next year, John, of top stories of 2022.
Hard to imagine it stopping.
Hey, listen, thanks to all of you who tuned into this episode of Healthcare IT Today. For more details about our show, check out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lin. Thanks for listening, and have a great week.